Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nigeria's anti-graft agency, EFCC, bars on vaccinated staff from premises in line with federal government's mandatory vaccination directive for civil servants. And Imo State intensifies vaccination campaign to sensitize the public, especially at the grassroots. And South Africa's Competition Commission reaches agreement to reduce costs of PCR tests by 40%. Thank you for joining us. It's a few weeks to the end of the year and the holidays are just around the corner. Over the past few days, different countries have been internalizing the emergence of the Omicron variants in different ways. So far, Nigeria is set to ban flights from countries that have also put the country on their red list. According to the Minister of Aviation, Hadi Sirika, the United Kingdom, Canada and Saudi Arabia will be paid back in their own coin with the impending ban. Well, how this will impact global diplomatic relations, only time will tell. Now let's take a look at today's COVID-19 update.
418 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 12 states, indicating a drop from the figures reported earlier. Lagos logged the highest infections with 314 cases, followed by Ogun with 27 cases. Plateau had 18, Edo had 17, while Enugu registered 11 cases. Other states, including Abia, Delta, Bayelsa, Kano, Rivers, Osun, and Oyo, registered a single-digit infection. The new tally has increased the total confirmed cases in Nigeria to 217,481. 43 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,746. There were no additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,981. More than 7.7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 3.9 million persons have been fully vaccinated. The total global confirmed cases have surpassed 270 million, while deaths are beyond 5.3 million.
Now, dozens of staff working with the Economic and Financial Crimes Commission, EFCC, were prevented from gaining access to their offices as the agency began enforcement of its Operation Show Your COVID-19 Vaccination Card or the PCR negative test result on staff of the Commission in Abuja. Secretary to the EFCC, Mr. George Epungu, who led the enforcement team, told journalists that any staff who refuses to comply with the directive will continue to be locked out until the Commission takes a decision on such staff member. The COVID-19 vaccination card is a major access card to most government offices in the nation's capital since the federal government began the enforcement for federal civil servants to take the COVID vaccines on December 1 this year.
People do not want to take the vaccine, some for inexplicable beliefs, some for ignorance, and then others for stubbornness. But at the end of the day, I don't think that there is any negative in taking the vaccine. I took it. I've had it since before I was appointed Secretary of the Commission. That is how to be disciplined. So for those who said they are not going to take the vaccine, they will continue to stay locked out until they take a decision. As we finish from here, we are also going to take a staff register of those who are present, and then as you can see our notes here, they are for those who have taken and those who have not taken. And we thought that you can never really know who and who has taken 1, 2, or 3 until you do a check. That was reinforced by the fact that cases of this nature, or especially the Omicron variant, is increasing or are increasing. So we thought that we should do, this is like a spot check, and our staff are enjoined to go to the clinic and then take their COVID-19 vaccine. So, but those who refuse to take, well, I may not take a final decision, but I think when the EC comes back, he will encourage management to take a firm decision on that.
Well, away from vaccination enforcement, over to the southeast, where the Commissioner for Health in Imo State says if Nigeria can achieve about 70% vaccination rate of its citizenry, then it could be said that Nigeria is winning the fight against the dreaded COVID-19 virus, which is taking many lives globally. The Health Commissioner disclosed this while speaking to newsmen during the flag-off of the state's mass vaccination exercise at the Owerri Municipal Council headquarters in the state capital. According to him, COVID-19 is real and government at all levels should continue to sensitize the public, especially those at the grassroots.
Continue counseling, advising people on the importance of these vaccines. That we've been doing all this period. We have also intensified that, and that is one of the reasons why we are even doing this mass vaccination campaign. We are health workers will now go to the respective communities, villages, to also give these vaccines to those who make themselves available. So we are appealing and encouraging our loved ones, our brothers, our sisters, our mothers, to avail themselves this opportunity to get vaccinated. Because this period now, it is free. Time may come when it will no longer be free. And we also want people to also understand that each time there is transmission between humans, that there is increased chances of mutation to occur. You can see the strains we have had. We have the alpha, we have the beta, we have the gamma, we have the delta. Now we are now having omicron variant. So it will keep on like that. But if we avail ourselves the opportunity and encourage ourselves, and we have about 70% vaccination within this country, then everything about the COVID would have been reduced drastically.
Researchers say that digital COVID-19 vaccination certificates for use in some countries are available to buy on the dark web. Most appear to be fake, but others may be valid entries in national databases that have been leaked. Well, the Presidential Steering Committee on COVID-19 a month ago raised the alarm about a black market existing for illegal vaccination certificate procurement in the country. According to the chairman of the committee, no vaccination certificate illegally procured would scale scrutiny whenever the need arises, as all vaccination records have to be verified as authentic at every relevant point. Well, to talk more about fakes and talking, this is as regards certificates, COVID-19 test certificates. Joining us in the studio in Lagos is Mr. Kenneth Okoli. He's the Chief Executive Officer, SynLab Nigeria. Thank you so much for joining us on the program.
Hi, good evening. Thank
Now,
you.
arriving passengers had complained that they were at the mercy of extortionists. And this was perhaps at the beginning of 2020 when, COVID hit us and everybody was pretty much struggling to put things in place so far. But recently we've seen that some have complained, some Nigerians boarding to major cities in Canada now complain that they were told they've stopped honoring PCR tests from Nigeria, and they were told to take tests, at the points, at the airports. They either had to take that test or the airline flies them back to where they were coming from, which is Nigeria. With all of this, what we're hearing, the claims, nobody is really certain about that particular case. But do you think that our COVID-19 test certificates is still going to the highest bidder, and that's if you haven't actually tested, you can get the certificate in Nigeria?
Okay, first of all, thank you for the opportunity to speak on this topic. I would not say that the COVID certificates are going to the highest bidder. Of course, I also am not naive to say that there are no individuals who are trying to, do some things here and there and coming up with certain things. But I would say in the last few months, the private sector and the government, when I mean the private sector, the accredited labs and the government have worked together to come up with some system. And I think the system has been in two phases. So the first phase was the fact when COVID started, there was a deluge of, well, I say, manipulated results, and this led to a lot of trust issues. And I'm sure channels aired it, where there was a form of investigation by a UK journalist, and they came up with a lot of things, and that led to the government and the labs coming up with a 2D authentication of the report. So you notice that when you get your results from the private labs, it has a form of a 2D barcode, which needs to be scanned at the port of entry at the airport. And when it is scanned, it takes you back to a verifiable website for each laboratory. We noticed that had a bit of cracks here and there, and the government went a step further to improve its database. So currently, immediately results are ready, each lab uploads the result onto the government's database, and at the port of entry, rather than the port officials just scanning your results, they can actually check on the government's database to see the veracity of your results. And that goes a long way, at least to restore trust and confidence with regards to the authenticity of the results coming from reputable labs. And I think that was a major issue we're having at the onset of COVID.
So if you have this sort of situation where they're saying that they weren't allowed to go with the test that they had done in Nigeria because they stopped honoring what's coming from Nigeria, where do you put the blame? Who's responsible for this?
Now, a lot of times we say perception to a large extent becomes reality for some people. And I wouldn't take away the fact that a number of countries are making their decisions based on previous things that had happened, which we would not in any way deny that it didn't happen or did not happen. But I think it's important, and I know the government is doing a lot to educate a lot of this high commissions and all of that on the steps that has been taken by the government. So I think if many of them would take this step, to really work with the Nigerian government, working with the Presidential Steering Committee to see the steps that have been taken by the government, both in Abuja and Lagos, where are the major ports of travel, I'm sure a number of them would have to reconsider. And I know there's been a huge journey from 2020 up onto 2021, so I think they would really do consider.
But would you say that it's possible to actually verify our certificates? Is there like a global accepted standard certificate that, the world can actually use?
Okay, I think that is what we're trying to achieve with the vaccination cards. With the testing, no, there isn't a central database where you can verify. Every government has its own. So I think that it's a bit of a challenge, but nothing is impossible with tech. I'm sure with some smart tech guys, if we could link up some APIs and all of that across all the government's databases, I'm sure it will be possible to do. But as of today, it's a challenge which we need to live with. But I think every government and across the world, all we need to do, working with the private sector, is to restore trust in the systems, and that goes a long way, to give the receiving country the trust to accept whatever you're doing, because everybody's scared. Nobody wants to admit more people with the risk of having people who have a virus coming into their country. So
what are your expectations to massive testing, as much as we are really vaccinating, but to also test, especially with the new variants coming up?
With massive testing, well, I don't think it's, yes, it's the ideal, but it's not easy to get that done, because at the end of the day, someone has to pay, Yes, in the UK, you have the NHS taking care of it. In Nigeria, a lot of people are paying out of pocket. Healthcare in Nigeria is majorly out of pocket. We can't get the government to start footing that bill right now because there are loads of other projects that needs to be done. However, I would say, to a large extent, if we all would simply do the basics, wear a mask, wash your hands, get vaccinated, get the booster dose if needed, I'm sure we'll be fine. But if you at any time are ill, I think one of the very first things to do, in any health center you go into, any hospital, is that to do a COVID test. But beyond that, I think we should just take all the precautionary measures.
We appreciate your time. Thank you so much. Mr. Kenneth Okodi is the Chief Executive Officer, CenLab Nigeria. Thank you for joining us.
Thank you very much. I appreciate it.
Still to come on the program, South Africa's COVID PCR testing to go down by 40%. We have that story and more when we return. South Africa's Competition Commission has announced that the fees for COVID PCR testing is to go down by 40% with immediate effect. This is the outcome of negotiations with major test processing laboratories in the country. In October this year, the South African Council for Medical Scheme took a complaint to the Commission requesting a reduction in fees. This has seen the fees slashed from 850 Rand to 500 Rand.
What prompted this was, the price itself and seeing, the level of the economy of scale within South Africa, knowing that majority of our people, may not be in a position to pay, such a price. So we then took it upon ourselves, and also being, having the experience within the private healthcare sector. We as the CMS, we want to look at it holistically. I mean, one of our mandates, is to influence national health policy, and we see the issue of COVID being a pandemic. It's part and parcel of a national health policy. So we as the CMS, our mandate within the preamble of the Medical Schemes Act is to protect the public. And that also includes members of medical schemes. So in the broader sense of things, we as the CMS, we thought this as a national level, it could benefit, everybody and ensure that, more people test and they don't sit not knowing whether they are infected or not.
At least one person in the United Kingdom has died with the Omicron coronavirus variant. British Prime Minister Boris Johnson said the new variant was also resulting in hospital admissions, and the best thing people could do was get their booster jab. Visiting a vaccination clinic in London, he said people should set aside the idea that Omicron was a milder variant. On Sunday, the Prime Minister set a new target for all adults in England to be offered a booster by the end of the month. He also declared the Omicron emergency, announcing that booster jabs will be offered to everyone over 18, and from this week, some medical appointments to be postponed to focus on boosters. Well, joining us to talk more about the situation in England, Dr. Olufemi Oyekan. He is a family physician at Basildon University Hospital in the UK. He joins us virtually. Thank you for joining us on the program.
Thank you.
I'd like to know first if you've heard about the potential for those coming to the UK to self-isolate at home instead of the 10 days mandatory hotel quarantine.
Thank you for making me part of this conversation. To the best of my knowledge, that information, it does not include the red list country which Nigeria specifically falls into that category. When we talk about the red list country, you are supposed to isolate in a government-owned center for 10 days, and you must have at least 2 negative COVID PCR tests before you can be allowed to leave the government center. But on the other hand, if you're coming from either an amber or a green country, what you have just said applies, because it's not all countries that have high incidence of the new variant called the Omicron variant. And what you will also note with regards to the situation in the UK, the fact that within the first week that the Omicron variant red alert was raised globally, 37 people that tested positive for the variant, 31 of them were migrants from Nigeria, which is one of the reasons why immediately when the scientists were trying to put up 1 or 2 together and realized that this variant is highly mutated, can break through immune barrier, and at the moment we are not sure if the vaccines are going to be able to protect against it. They had to put Nigeria and a few other Southern African countries into the red list. So that's where we are at the moment.
Over the weekend, we heard about studies that says, okay, maybe the vaccines, 2 doses aren't enough, but a booster, makes it more sufficient, about 75%. How are people reacting to the booster target by the Prime Minister?
To be very honest with you, because of how there's a credible cohesion between government and the people, where people understand here that the government specifically speaks and fight for them and to ensure that there is safety of life and properties. There has been a huge surge, including myself. I just had my third booster dose, and a lot of folks across the country are rushing to go and ensure that they have the third booster dose because of the fact that there's a lot of transparency on how information have been disseminated so far. The data are very clear that the 2 vaccines are those may not be sufficient because of what I said earlier, the highly mutated new variant of the Omicron, which is one of the reasons why the government is saying that in order for us to be able to at least have an understanding, pending when the pictures become very clear, that it's important for us to ensure that everybody within the vaccinable age gets a booster dose. And this is what's been going on. And the target at the moment is about 1 million per day. It might be difficult because the NHS is already overstretched, but what they're doing is they're using various centers, the GP centers, these primary health care centers to become part of the vaccination centers to be able to meet this target. So that's what's going on at the moment.
Would you say the UK still has a number of people who are hesitant to take in the vaccine in the first place?
Absolutely. You still have a lot of people who have beliefs that this is another flu to go away. And there are some people that feels that, if I die, what's life anyway? So, and a lot of people believe that they're considering a lot of, like in the Western world, a lot of cancer and all of that are not usually common in most developing world, that sometimes some of these cancers could possibly be linked to vaccine. They are still going to wait and see what happens in the next 2, 3, 4 years to see what comes out. Well, the sad thing is the fact that most people that have come out to like severely affected and died from COVID-19 lately, post-vaccine days, have been those who were not at any point in time keen to receive the vaccine, which is the sad news.
All right. Also, the new restrictions ahead of winter is, home working arrangements if you can, more mask rules, theatres, cinemas, COVID pass mandatory into nightclubs. I'm sure not everyone is quite happy with this arrangement.
Yeah, the thing is, a lot of people here enjoys their freedom, and partying, outdoor activity is part of the normal norms of people's day-to-day life here. So by bringing COVID restriction to take away those fundamentals of life, a lot of people are not happy. But the good thing is the fact that the vaccine is there as an option. Go and take it, which a lot of people are rushing to that option. Then working from home is also something that has almost become part of the normal now. A lot of people work from home because reduce walking like when people are in a lot crowded area. It's been known to become the focal point for where people get the COVID-19. So a lot of people are comfortable with that. But what people are not comfortable with is for you to be able to attend any large gathering, to go to any party or to enter any pub, you have to have a negative lateral flow test, or that the other option is to have a COVID mandate vaccine, that you have to produce a COVID passport before you can. A lot of people here feels that it infringe on their fundamental rights as human beings, that they have a right to choose what to do and what not to do, and they don't want government to enforce a decision on them. So this specifically has to,
especially with the doubling time for the Omicron variant in the UK. We would like to appreciate your time. Thank you so much, Dr. Olufemi Oyekon, family physician, joining us from the UK. Many thanks.
You're welcome.
Meanwhile, back to South Africa, where President Cyril Ramaphosa is receiving treatment after testing positive for COVID-19. Now, a statement from his office says the 69-year-old has mild symptoms and is isolating in Cape Town. South Africa has seen a surge of infections since the new Omicron variant was first detected in November. Here's more on the global update.
The South African presidency says President Cyril Ramaphosa is showing only mild symptoms and is self-isolating in Cape Town after delegating his duties to his deputy president, David Mabuza. The presidency did not say whether Ramaphosa had been infected with the Omicron variant of the coronavirus. In a statement thanking South Africans for their support after he tested positive for coronavirus on Sunday, President Ramaphosa says his own infection serves as a warning to all citizens of the importance of getting vaccinated and remaining vigilant against exposure. Over in the UK, Prime Minister Boris Johnson has confirmed that one person has died with the Omicron variant of the coronavirus. Johnson was speaking to vaccination centre staff.
We can see Omicron spiking now in London and some other parts of the country. Here in the capital, it probably represents about 40% of the cases. By tomorrow, it'll be the majority of the cases, and it's increasing the whole time. And sadly, yes, Omicron is producing hospitalizations, and sadly, at least one patient has now been confirmed to have died with Omicron. So I think the idea that this is somehow a milder version of the virus, I think that's something we need to set on one side and just recognise the sheer pace at which it accelerates through the population.
British Health Secretary Syed Javid meanwhile warns the variant is spreading at a rate never seen before.
What we've learnt about this new variant, Omicron, just in the last week is that, first of all, it's spreading at a phenomenal rate. The number of infections is doubling every 2 or 3 days. There's going to be a tidal wave of infection.
You can visit our website for more updates, a better understanding of the pandemic and breaking stories. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.